Thank you, doctor, again for doing this for the audience, who have been asking for something really crucial that they wanted to hear from a cardiac surgeon. ನೀವು ಅದರದ್ದು ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಮಾತಾಡಿದ್ವಿ, ವಾಟ್ ಆರ್ ದ ರೀಸನ್ಸ್ ಫಾರ್ ಹ್ಯಾವಿಂಗ್ ಅ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಮಾತಾಡಿದ್ವಿ, ವಾಟ್ ಆರ್ ದ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜಸ್ ದಟ್ ವಿ ನೀಡ್ ಟು ಮೇಕ್ ಟು ಹ್ಯಾವ್ ಅ ಗುಡ್ ಆ್ಯಂಡ್ ಹೆಲ್ದಿ ಲೈಫ್ ಮಾತಾಡಿದ್ವಿ. ಇದೆಲ್ಲ ಆದಮೇಲಿಂದನೂ some patients have to undergo surgery. So if you have to really talk about something, this is very crucial. ಸರ್ಜರಿ ಆದಮೇಲಿಂದ ಒಂದು ಪೇಷಂಟ್ನ ಹೆಂಗೆ ನೋಡ್ಕೋಬೇಕು, ಇದು ಎವ್ರಿ ಹೌಸ್ ಹೋಲ್ಡ್ ವಿಲ್ ಹ್ಯಾವ್ ಸಂಬಡಿ ಹೂ ಇಸ್ ಅಂಡರ್ಗಾನ್ some kind of a surgery. But if you have to particularly come to this kind of a heart surgery, ಅದು ಆಗಿ ಮನೆಗೆ ಬರ್ತಿದ್ದ ಹಾಗೇನೆ ಯಾವ ಥರ ಪೇಷಂಟ್ನ ನೋಡ್ಕೋಬೇಕು, ಇದು ಒಂದು ಸೆಷನ್ನಲ್ಲಿ that I would like to cover a few things with which I have personally so many doubts.
I'm glad we are doing this because this is we have to accept the fact that there are a small subset of patients, which is unfortunately becoming larger now, who will need heart surgery for various reasons. I'm not just talking about blocks. It can be a valve operation or something to do with the aorta. Some people will have tumors inside the heart, and there are so many things which technically is not something we can change. So valve operations are, even in today's world, we have something called as rheumatic heart disease, which is infection of the heart valves, and the valves get damaged and we have to replace it. So there are certain situations where the patient might have a healthy lifestyle. There are other reasons why they'll have a heart problem and they'll need surgery. So what we have seen in our practices most commonly is that after heart surgery, the patient goes home and then doesn't come out of the house, because this is a very big misconception that heart operation ಆದಮೇಲೆ bed rest. He's an heart patient, ಅವರಿಗೆ ಏನು ಮಾಡಕ್ಕೆ ಬಿಡಬೇಡಿ. It's a very common misconception. And we have seen it in our practice, irrespective of how many times we tell them, when they come for follow-up, अभी क्या कर रहे हैं, कुछ नहीं कर रहे हैं. क्यों नहीं? हार्ट पेशेंट है, उधर घर में, मतलब लोकेलिटी में सब लोगों ने बोला उसको घर में
ध्यान से रखा
करो, कुछ नहीं करना है उसको. So that is a very common. See, I am not trying to blame them, because there is a fear that something will happen. So again, not a blanket rule, but most of the patients who have had a good functioning heart, an uncomplicated post-operative course, and if the surgeon who is treating you says that go slowly, get back to your normal life, please listen to him. Because a large part of the patients who come to us thankfully come at an earlier stage of disease, and they go back not technically as patients. They can actually go back to their routine life.
Interesting.
Yes. So, and also in today's world, you have minimally invasive surgery, robotic surgery. Not it is come into heart surgery, not as much, but there is a definite percentage of patients who will benefit from this, and their recovery periods in many of them will be faster compared to the conventional surgeries to do. Again, irrespective of what kind of surgery you undergo for the heart, you can lead your normal life, and that is why you are undergoing the surgery. The surgery is not done to make you a patient and sit at home.
Oh,
that is the good thing we should
line actually.
Yeah, that is a good thing you should remember. And importantly, the relatives, because they will say make him sleep, don't make him do anything. That actually becomes counterproductive. It becomes more damaging to him, because he will be exposing himself to the same risk factors what he's had before. So if he's not active post-surgery, if he is not taking care of his exercise regimen, what we have advised, again in the next 2-3 years he's going to have another set of problems in the heart. So recovery period may be about 2-3 weeks or about 4 to 6 weeks, depending upon how much the surgeon advises you. But most of the patients, the moment they are out of the ICU post-surgery, we actually get the physiotherapist to work on them in the ward itself. We don't even allow the patient to sleep in the ward during the daytime, because they need to be active. So that is hardly about 3 days post-surgery. So then you can understand that there is no question of bed rest for a patient who undergoes surgery, heart surgery in specific. They have to be active. There are certain physiotherapy exercises which will be advised. There is a spirometer to make them, do the ball exercise where it helps in recovering of their lung function. Then the physiotherapist will actually make them walk upstairs for one flight of stairs slowly and bring them down. This is all supervised, but they have to do it. So the most common response from patient relatives will be, no, he's not climbing stairs now. He's not even, please make them walk as advised by the surgeon. We have another set of people who are rehabilitation specialists.
And I just wanted to ask
Yes.
you that. So, do you mean to say that these patients have a specific set of people who can help them in their rehabilitation?
Yeah, maybe 20 years ago, it
ಯಾಕಂದ್ರೆ
was.
ಇವಾಗ ಎಲ್ಲದಕ್ಕೂ ಒಂದೊಂದು
Yes.
ಸ್ಪೆಷಲೈಸೇಷನ್ ಅಂತ ಬಂದ್ಮೇಲಿಂದ ಅದಕ್ಕೆ ಅಂತಾನೆ ಒಂದಷ್ಟು ಸ್ಪೆಷಲಿಸ್ಟ್ ಕೂಡ ಇರ್ತಾರಲ್ಲ.
ಹೌದು.
ಸೊ ಆ ಥರದವರು ಇದ್ದಾರಾ?
Idare, and it is, see, whenever you have a specialist in a field, now imagine you come and ask me about something to do with the abdomen. It is, morally wrong for me to give you advice on that. Even though my primary training has been in medicine, I cannot and I should not give an expert opinion on some field which I am not specialized in. So previously it was the responsibility or the duty of the primary treating surgeon itself to teach all these exercises and all that. But now we have rehab specialists, and they are definitely important part of our team.
ಸೊ ಕಾರ್ಡಿಯಾಕ್ ರಿಹ್ಯಾಬ್ ಅಂತಾನೆ ಇದೆಯಾ ಒಂದು?
It's coming up, and there are people who have, they will help you with telling you what to do, especially if you have had a complicated post-op course. They will teach you how to do, what to do, how many hours to do it, and how to space out your routine every day. Take their help. It definitely helps. Definitely.
So in the time ಅಲ್ಲಿ, see, there are quite a few patients who must be in their early 30s or in the late 20s also. So these are, you can't rule out that such people wouldn't have had a heart surgery. So ಇಂಥ ಕ್ಯಾಟಗರಿನಲ್ಲಿ who are used to probably going to the gym as against the rehab centers post surgery, what would you advise?
Yeah. So these are all case specific. So disease specific.
Correct.
What problems they have had, and I would strongly suggest take the advice of your treating surgeon. If your medical condition allows you to get back to what you're
Because
doing.
a doctor ಹೇಳ್ತಾರೆ you can just go back to your normal life.
Yes.
This normal life ಅನ್ನೋದು such a relative term, because I might understand my normal life to getting back to my actual normal life that I used to lead.
Correct.
Prior to the surgery. So which could include even hitting the gym.
Correct.
So ಆ ಟೈಮಲ್ಲಿ
That has to be graded. So definitely surgery is a major event in your
Correct.
life, especially heart or brain or any major organ surgery. So recovery period, even though it's nice to see some patients recover very fast and they are back on their feet very early. Even then, the suggestion would be take it slow. So hitting the gym probably should take a few months, or even if you're doing it early, your exercise should be graded. Take baby steps. Ain urgent illa. But you do it every day, your body adapts to it, and it definitely helps your body. You do it like probably half an hour or 15 minutes initially, then you slowly step it up, make it half an hour. If you're not able to do it in one stretch, do it twice a day. So these are the things, is a very simple rule to follow. If you have a problem, take a help of a rehab specialist.
Super. I might seem like a stupid to ask you some simple silly questions ಅಂತ ಅನ್ನಿಸ್ಬೋದು, ಬಟ್ ದೀಸ್ ಆರ್ ದ ಥಿಂಗ್ಸ್ ದಟ್ ನಮಗೆ ಮನೆಗಳಲ್ಲಿ ಖಂಡಿತ ಇಂಥ ಥರದ್ದು ಡೌಟ್ಸ್ ಬರುತ್ತೆ ವೆನ್ ಯು ಹ್ಯಾವ್ ಅ ಹಾರ್ಟ್
It's
ಪೇಷಂಟ್.
very important to ask silly questions. A simple problem what we deal is patients don't have a bath on the wound post surgery. Then they come back with wound infections. So I am always open to all kinds of questions
So
because they hide it. So then they come after 2 weeks with the infection of the chest or the leg or whatever. The reason? Nahi na hai.
So how important is it to keep your area clean?
Yes, you have to have a daily bath.
ಡೈಲಿ ಬಾತ್
Yes.
ಮಾಡಬೇಕಾ? ಬಿಕಾಸ್ ಅಲ್ಲಿ ನೀರು ಬೀಳಬಾರ್ದು ಅಂತಾರೆ, ಅಲ್ಲಿ ಒಂದು ಪ್ಲಾಸ್ಟಿಕ್ ಕವರ್ ಐ ಮೈಟ್
Yes.
ಸೀಮ್
No,
ವೆರಿ
that is a
ವೆರಿ
very, very
ಸ್ಟುಪಿಡ್
well,
ಬಟ್
very, very, very,
ಅಲ್ಲಿ
very
ಒಂದು
well.
ಪ್ಲಾಸ್ಟಿಕ್ ಪೇಪರ್ ಹಾಕ್ಬಿಟ್ಟು ಅಲ್ಲಿ ಒಂದು ಪ್ಲಾಸ್ಟಿಕ್ ಥರನೋ ಹಾಕ್ಬಿಟ್ಟು ಅದಕ್ಕೆ ಗಾಯ ಆದರೆ ಅದಕ್ಕೆ ಹಸಿ ಆದರೆ ಮತ್ತೆ ಇದಾಗತ್ತೆ.
It's a very valid point. Have a bath. Don't rub your wound, but let soap water fall on it. Dry it, dab it with a clean cloth, and keep it dry. Some patients might have some oozing. Go to your doctor, get the dressing done. But that doesn't stop you from having a bath. General cleanliness and hygiene is very, very important as in normal population, especially more important in patients who have undergone surgery.
ಸೂಪರ್. ಆ್ಯಂಡ್ ಇವಾಗ ತಿಂಡಿ ಗಿಂಡಿ ಎಲ್ಲ ಮಾಡ್ಕೊಡ್ತಿರ್ಬೇಕಾರೆ ಸರ್ ಇವಾಗ ಎಸ್ಪೆಷಲಿ ಹಾರ್ಟ್ ಸರ್ಜರಿ ಆಗಿಬಿಟ್ಟಿದೆ ಅಂತಂದರೆ ಕೆಲವು ತಿಂಡಿಗಳನ್ನ ಕೊಡೋದಿಲ್ಲ. ದೇ ಬಿಕಮ್ ಎಕ್ಸ್ಟ್ರೀಮ್ಲಿ ಕಾಷಿಯಸ್ ಇನ್ ದ ಡಯಟ್ ದಟ್ ದೇ ವಾಂಟ್ ಟು ಫಾಲೋ ಫಾರ್ ದ ಪೇಷಂಟ್ ಇನ್ ದ ಹೌಸ್ ಆಸ್ ಅಪೋಸ್ ಟು ವಾಟ್ಸ್ ಬೀಯಿಂಗ್ ಕುಕ್ಡ್ ಫಾರ್ ದ ಅದರ್ಸ್.
Correct.
ಆಗ ಇದು ನಿಮಗೆ ತಿನ್ನಬಾರ್ದು ಅಂತ ಹೇಳ್ಬೋದು. ವೆರಿ ಸೆನ್ಸಿಟಿವ್ ಥಿಂಗ್ ಆ್ಯಕ್ಚುಲಿ.
Correct.
ನೀವು ಆವಾಗ ಐ ಮೀನ್ ವಾಟ್ ಯು ಅಡ್ವೈಸ್ ದ್ಯಾಟ್ ಪೇಷಂಟ್, ಎಸ್ಪೆಷಲಿ ಒಂದು ಬಜ್ಜಿ ಅಂತ ತಗೊಳ್ಳಿ ಇವಾಗ.
Yeah. So,
ತಿನ್ನಲೇಬಾರ್ದುನ, ಯಾಕಂದರೆ ನಾವೆಲ್ಲರೂ ತಿಂತಿರ್ಬೇಕಾದ್ರೆ ಒಂದು ಪೇಷಂಟ್ ಇದ್ದಾಗ ದಿಸ್ ಇಸ್ ಅ ವೆರಿ ಕಾಮನ್ ಥಿಂಗ್ ಆಯಿತಾ, ಅಂದರೆ ಅವರಿಗೆ ಅದಾಗಿದೆ ಅದನ್ನ ಕೊಡಲೇಬಾರ್ದು ಇಟ್ ರಿಯಲಿ ಹ್ಯಾಪನ್ಸ್.
see, we are talking about real life scenarios where the patient post surgery goes into his community, to his house. So now our primary focus is on iga bajji illa. You're basically talking about very oily items.
Oily food.
Yes. So the reason why a doctor would say, completely avoid is very simple. If the doctor says that, you can have it once in a while, then that once in a while becomes too frequent. It's the same thing with people who get back to smoking post surgery. So, or alcohol for that matter.
I was just going to come to that next actually.
So the diet is also the same thing. So technically a blanket ban on everything may not be practically feasible, but there should be somebody in the house who should keep a monitor, or the patient, if he is very, very vigilant, make sure the diet is followed strictly, because that will help his condition in the long run. So definitely.
Healing is faster.
Not only healing, even the long run, if you are going to go back to having a lot of oily food and, no control on your food, your cholesterol dose of the medicines which you use for cholesterol, the doses keep on going up, which absolutely makes no sense.
Correct.
So
Again.
you need medicines, but you can actually reduce the dose if you are strict on your diet. It's as simple as that.
Super. ಇದನ್ನು ಅಷ್ಟೇ, ಅಗೇನ್ ಇಫ್ ಯು ಹ್ಯಾವ್ ಟು ಕಮ್ ಬ್ಯಾಕ್ ಟು ದಿಸ್ ಕನ್ಸಂಪ್ಷನ್ ಆಫ್ unwanted substances,
Yes.
but then which has become everyday nuisance in some people's lives.
Frankly speaking, lifestyle changes in post surgery patient is no different from the other people. Even the other people have to follow that.
Yeah.
So because the reason why the other people have to follow it is to prevent development of an organ disease. So it's the same rule that applies to the patient who's undergone surgery or not. So it's not very complicated in that sense. You follow a healthy diet, it helps both.
Super. So finally, to wind up, if I have missed out on anything that I haven't asked, probably the patient has to keep note of it post surgery. Anything that
from a surgeon's viewpoint, if you have been told that you can get back to your normal life,
ಆಫೀಸಿಗೆ ಹೋಗೋದು ಅದೆಲ್ಲ
yes, definitely, there's no restriction at all. I mean, maybe a recovery period of probably 3 to 4 weeks is the maximum what we would advise, sometimes even lesser than
even
that.
for office goers.
Yes. So independent, riding a vehicle or driving a vehicle, whatever, two-wheeler or a four-wheeler, may not be advised initially, even though that also is sometimes allowed. But just to be on the safer side, probably for the first few months, it's preferable you don't do something independently. But it doesn't mean that you have to sit at home. Absolutely not. Unless you've had a very bad disease, your heart function is very low, and your activity level may not be, it may not allow your activity level, which happens in very small percentage of patients. In those cases, the surgeon himself will tell you that there are certain things you will have to restrict yourself. But otherwise, general walking, climbing a flight of stairs slowly in a graded way is definitely allowed, definitely recommended. What is not allowed, extreme exertion definitely is not allowed. You can't expect a patient post surgery to run 5 flights of stairs. That is definitely not recommended. But general going to your office, doing your job, coming back is actually recommended because it helps you recover, helps you get back to your normal life.
So makes you, I think, stay happy and healthy.
Yes, you are busy mentally, and
you don't keep thinking about the same thing. ಇವಾಗ ಅವಾಗ ಏನಾಗ್ಬೋದು ಅದೇ ಒಂದು ಆಂಗ್ಸೈಟಿ ಮೋಡಲ್ಲಿಂದ ಹೊರಗೆ ಬರಲಿಕ್ಕೂ ಐ ಥಿಂಕ್ ಇಟ್ ಹೆಲ್ಪ್ಸ್ ದೆಮ್ ಟು ಬಿ ಆಕ್ಟಿವ್ಲಿ involved in any other activities around them.
Keeping yourself busy is very, very important.
Thank you. So thank you, doctor, for just giving us a beautiful information which was absolutely insightful and very crucial for all of us to know, because now, like I always say that we are the common public who wouldn't know so many small little things, and if that comes from somebody who is an authority in that field, and it's absolutely useful, meaningful and fruitful. Thank you so much for your time once again.
Thanks again. Thank you for the opportunity so that I could explain these things on a video so that people can get
you don't even know what kind of a huge contribution that you are making, which can, even if it means 10 people take it seriously and then make those amends in their life, and you are indirectly saving their life. So it's such a beautiful way of giving back to the society.
I think it's everybody's responsibility to do that. So I think it's
it's so generous of you to really take your time off amidst all your busy schedules. I know how busy you are, but coming and then giving the time, and then idu simple things irbodu adakke sumarashtu janake time ildirಬೇಕಾ time ಮಾಡ್ಕೊಂಡು ಬಂದು ನಮಗೆ ಹೇಳೋದಕ್ಕೆ thank you so much. It definitely helps in saving lives. Definitely. Directly.
I hope it does. That's the whole intent actually. Thank you.
Thank you. Thanks, doctor.